My name is Hazel. I'm Hazel Watson. I am the Head of Mental Health and Learning Disability in the Nursing Directorate for NHS England. And that's important because it's the Nursing Directorate, the Chief Nursing Officer, who is the lead executive for the Learning Disability Programme that I want to talk to you about in NHS England. I am a learning disability nurse. I'm very proud to be a learning disability nurse. And I spend a lot of my time thinking about how we develop the learning disability programme and actually what works for people and what works for them and their families. So what I want to talk about this morning in my very strictly given 15 minutes, so I'll try and hold myself to time, is just a bit of an overview of the learning disability programme in NHS England, why it's so important and what it is that we are hoping to achieve. So, Steve talked about the fact that learning disability is one of the clinical priorities for NHS England for this year. Hurrah, I hear you cry. And it comes from the fact that actually learning disability is a political priority at the moment. Now, that priority doesn't necessarily come from a good place. What it comes from is the fact that the Winterbourne View Concordat, the promises, the recommendations that we all made after Winterbourne View, we haven't actually delivered on in the most timely fashion. So it doesn't necessarily come from a good place, but what it does do is give a political focus, and that political focus translates into the government telling NHS England through the mandate what the priorities need to be, and therefore NHS England identifying those priorities in its business plan. So, learning disability is one of the 4 top clinical priorities for NHS England for this year, and we are expecting that to be the same for next year. So the work that we're doing on learning disabilities is critically important to NHS England, and what we're doing is working, as people will know, with Local Government Association Directors of Social Services, of Children's Services. We're working with the CQC and we're working with Health Education England to really try and make a difference to the lives of people with a learning disability, in particularly to improve the health services that we offer. So we are, of course, developing the national framework to close inappropriate facilities. There will be, if this programme is successful, and we absolutely need to make sure that it is, there will be fewer inpatient services for people with a learning disability in this country, and there will be more proper community support services and services that support people to live the life that they want to live. And as we were thinking about health inequalities more generally, we have now established the Learning Disability Mortality Review, and this is the organisation that's going to help us think about why life expectancy for people with a learning disability isn't as good as we would all want it to be, and therefore what we need to do about it in order to improve that. And we have set up some data tracking so that we know where people with a learning disability are, we know where they live, we know what their hopes and aspirations for the futures are, and we know what services we need to provide. And although that sounds small and quite techie, actually 2 years ago we didn't know. We didn't have that information nationally. So in order to be able to support a proper programme of movement and also to actually demonstrate that we've made a difference, we need to know. We need to know and understand the data that supports it. So are we making a difference? Well, yes, I believe we are starting to. So when we first started looking at people in inpatient units last June, we knew that we had this many inpatients in place, and that actually we knew that this many people had a discharge plan in place. And some 12 months later, having done an enormous amount of work to review people's care and to talk to them about their aspirations for the future, we now know we have this many inpatients in place, but we have a significant number of discharge plans now in place, plans for people to move on and to live a different sort of life. But of course, what we know is that actually those two numbers aren't vastly different, given all the work that we're doing, because as fast as we're offering discharge opportunities for people, so we are admitting an equal number of people, because we don't have yet proper services in the community that either stop people going into hospital or support people to get out of hospital. That is the focus of the work. But we are starting to make some difference. We are starting to see for the first time fewer people being admitted and more people being discharged. What we are saying to both CCGs and local authorities is very often people know when people are at risk of going into hospital, when something's breaking down, when something's not working for them in their lives, well, actually, instead of waiting until that happens, get in there, do a review of that situation, work with that person and their families and with services and see what you can do to put something in place, some additional support to stop that admission happening. That is starting to make a difference to the type of service that we're now able to provide. But, and I will just quickly move on to this. As I say, we know that we don't have services in place universally. Some places have really good services, some places have not so good services. So we are about to publish a national service model that says, actually, these are the range of services that we should be offering to people with a learning disability and their families. And a national transformation plan that says, and this is what we would like you to do about it. So we've been trialling some of that over the summer in a number of what we euphemistically call fast-track areas to trial this. How can we plan? How can we make a difference? And 5 or 6 areas of England have been working really hard to come together to think about what plans they need to put in place and how they're going to commission services better and differently with people and their families. And the output of all of that fast-track work and everything about what we know will help to inform the National Transformation Plan, which we're hoping we will publish before the end of October. So what have we done? We have the Assuring Transformation data in place, and you can see that on the NHS England website. You can see that on the HSCIC website. You can see it by local authority area. You can see it by CCG. You can see it nationally. You can see it by numbers of inpatients. You can see it by age of people in hospital. It's all there for people to see, to use, and to inform the discussions they're having locally. We've done a lot of work on care and treatment reviews, supporting people to think about their imagined future and what their discharge planning would look like. We are about to publish the new service model to say to commissioning colleagues, both health and social care, this is what we think good looks like. And certainly some of the learning that I'm taking both from today and previous conversations that I've had with HFT is, and what is the role of technology in that? And I'm not sure that really we've explored that to the degree that we need to. So I shall be taking that back to colleagues in NHS England.